Hello and welcome to another episode of USTM podcast, where we bring you expert discussion on topic that matters. I'm your host, Fetisha Syiemiong, and today we are diving into a crucial health concern, which is cervical cancer and how to get rid of it. Cervical cancer is one of the most treatable and preventable cancer, yet it continues to affect countless of women worldwide. Early detection, vaccine, and right medical approach can make a huge difference. To help us understand better, we have today with us expert Dr. H.K. Sharma, Head of Department of Obstetrics and Gynecology, PA Sangma International Medical College and Hospital, Meghalaya. With an incredible 35 years of experience, Dr. Sharma has dedicated his career to women's health and play a vital role in advancing medical practice in this field. In this episode, we'll be discussing about the cause, prevention, treatment, and the latest advancement in this field of cervical cancer, providing insight which every woman should know. So stay with us as we explore the importance on this topic with one of the best in this field. Now, let's welcome Dr. H.K. Sharma, sir. We welcome you to the show, sir.
Thank you, Fetisha.
Thank you so much, sir, for being with us today. We are sure that this discussion on cervical cancer has created a great awareness on our viewers. Sir, what would you like to say about cancer cervix in women?
So, thank you for asking a very pertinent question. So, nowadays it's a very important question which is very commonly discussed and asked about the cancer cervix because it is found to be very common among the Indians. In fact, as per Globocon statistics from 2022, in India it is the second most common disease, malignant disease among the women, and which is also second most killer malignant disease among the women, and which is in the world statistics it is the fourth killer disease or fourth common malignant disease in women, right? So that is why we have to discuss it nowadays very commonly and very importantly. And another important thing is that this is one of the cancer which can be detected early and which can be prevented totally if we take proper measure right at the right moment. Okay, so that is why it is a very important topic to discuss, and we will going to discuss on this topic today.
Thank you so much, sir. Sir, what is the importance of screening in cancer cervix?
Right. Okay. So this is very important to know what is screening. Screening means we have to select some of the patients or some of the individuals which are more prone to develop cancer in near future. Okay, so that is the idea, and with that idea we do some test, and that is called screening test. And this screening test is very much relevant in the case of cancer cervix, because in this cancer cervix what happens, it doesn't happen on one day suddenly. It takes long time. So there is a long time from 5 years minimum to more than 10 years time of life that there will be some changes in the cervix, especially in the cells of the cervix. And cervix, you know, that is a part of the uterus or part of the womb, and we say it is the neck or it is the opening of the womb, and which can be accessible from below, from outside, and we can test it at regular interval. Okay, it is not at all difficult, and that is why we can take some, we can do some test or we can do certain examination of the cervix, and we can see some changes. So there are series of changes which occur for many years, and these changes will ultimately develop to cancer. Not in all patients. Out of 100 patients, there will be 20 patients who will develop cancer, or there will be 5 patients who will develop cancer. The others will heal automatically. So this can be seen, and this can be tested, and that is the screening test. So there are so many screening tests are available, and out of that one screening test which is very cost effective, or you can say it is cheap, and it is can be done in a low resource setting, and also in a very peripheral centers, in a remote areas where all type of high-tech facilities are not available. We can do that there. That is, especially we can collect the samples there, and then we can test it. It doesn't take much. It's not at all costly. So it is very useful as a screening method. and we can find out the patients or find out the individuals who are vulnerable to develop that one, and we can do further tests in those patients. Okay, that is why it is very good. It's called PAP test, PAP. Okay, so besides that, there are so many other tests, like one is HPV testing, which is also very simple. We can take the sample and can send it to laboratory and we get the report. Okay, it is not at all painful, can be done with an OPD procedure. We can do colposcopy, which is an OPD procedure, but it is a bit high tech, so it is done in tertiary care centers only. Okay, so these are needed for selected patients, not all patients. But pap smear is very easily available, safe procedure which can be done in mass population and which can reduce the cancer statistics in great extent. Okay, and besides that, there are some other tests like VIA, that is visual inspection with acetic acid, VILI, that is visual inspection with Logos iodine. So these are also not at all costly, and it can be done in a peripheral setup. And even it can be done by the health workers or paramedical personnel when they are trained properly. Okay, not only by doctors. So they can do it, and they can select out some of the patients, and they can send the patients at the right moment to the proper centers for treatment. Right?
Thank you so much, sir, for giving us insight regarding the cancer cervix, which is very required for prevention and precaution factor. So, sir, what are the cause and risk factor of cervix cancer?
Right? This is really a right question, because if you have to treat a disease or if you want to prevent a disease, you must know the causes or the risk factors which is affecting the disease or which helps in occurrence of disease, right? So in cancer cervix also there are some causes, there are some risk factors. So out of the causes, the number one and most important cause is HPV, human papilloma virus, and this is one viral infection which is responsible for more than 90% cases of cancer cervix. Okay, so that is number one, an important cause. And besides that, there are some other, okay, we cannot say it as cause, these will be definitely factors. So these factors will also affect it. Say like is one, say early marriage, okay, early marriage, or we can say that is the actually early exposure to sexual contact. Okay, so that is maybe in the form of early marriage, and it may be because of the promiscuous sexual habit. And there are other factors related to sex, is there's multiple partners. Okay, so in this type of condition, and even unprotected sex, especially with HIV, when there is risk of HIV infection. Okay, so there are risks of STD infection, that is sexually transmitted diseases. So these patients are always vulnerable for this type of disease. And besides that, there is high parity, that is patients who are having more number of children. Okay, and those patients are always vulnerable, and low socioeconomic status. That means in the poor community, that may be different ways, maybe the poor nutrition, poor hygiene, all these type of things will come. So all these things will be there. And besides that, there will be some general factors which are for all the other cancers. Like one is smoking. That is one important cause which will act in different ways in occurrence of the cancers. It is common to all. Then there is another one, alcohol. Okay. So nutrition already I have mentioned. So these factors will be there. Okay.
Sir, since you have given us the valuable knowledge regarding the risk factor of the cervical cancer, so sir, is there any way to detect it and in order to prevent it?
Already we have discussed about the screening factors or the risk factors, causes, all these things. But now we will have to say the few words regarding the early detection. So if you want to detect a cancer cervix early, definitely you have to know some of the important symptoms which will occur in the early cancers. Okay, and there will be another points, that is how it looks like and what we will see. Okay, when we see the patient. So actually regarding the symptoms, that means what the patient complains of. So two important things are there. One is bleeding and another is discharge. So one is vaginal bleeding. So vaginal bleeding may be in different forms. One is known as postcoital bleeding. That means after sexual contact, if there is bleeding. So that is known as postcoital bleeding. So that is one ominous sign of an early cancer. Another one is the postmenopausal bleeding. A woman who has attained menopause, that means there is permanent cessation of menstruation. Then after that, there is bleeding. So that is also not normal. So that is another ominous sign of early cancer. early cervical cancer, right? Then there might be other cases where there will be intermenstrual spotting. That means in between two menstrual cycle, there will be irregularity, there will be spotting. Okay, so that is another sign. And in some of the patients, there will be irregular bleeding or severe bleeding with continuing irregularity. Okay, so there are other cases where you don't find bleeding in this manner, but there will be discharge. So discharge may be in the form of white discharge, which is not treatable by conventional means. Okay, it recurs off and on. Okay, another one, excessive vaginal discharge, which is offensive. Okay, there might be vaginal discharge which is mixed with blood-stained discharges. There might be offensive vaginal discharge which is mixed with normal vaginal discharges also. Okay, so this type of discharges are also always suspicious, and we have to think that maybe an early cancers, right? So in those cases, you have to do investigations. So when you see and when you examine, then you may get a growth in the cervix, which may be exophytic. That means which is a outside growth. That means it is proliferating outside, which can be seen from below. It can be felt also. There might be an ulceration, something like an ulcer which is not healed, and that leads on pus. And sometimes the cervix is not showing any growth or any ulcer, but still it is not a normal cervix. It is a very bad cervix. We call it bad cervix or unhealthy cervix, which is very congested, almost red in color. Once you touch, there will be bleeding. Okay, so these are some of the signs of early carcinoma cervix or early cancer of cervix. Okay, so in this case, definitely you have to do a biopsy, and once you do a biopsy, it becomes a confirmed diagnosis. So confirmatory diagnosis is after a biopsy. We have to do a biopsy in that case, right? That way we take the tissue from there and we send it for histopathological examination.
Sir, as you have mentioned, the rapid growth of cervical cancer not only in India but in the world. So, sir, is there any vaccine to prevent it?
So thank you for asking this question, because it is the most pertinent and most important questions today's discussion, because we are ultimately going for prevention. So ultimate prevention is definitely by a vaccine. So if you want to stop a disease to occur, so ultimate is the vaccine. So vaccine is there in case of CA cervix. It is unlike in most of the cancers. So we are fortunate that for carcinoma cervix we have vaccines. Because already I told you that there is a viral cause, that is HPV, human papilloma virus, which can be associated in more than 90% cases of carcinoma cervix. So that is one of the most important things. That is why vaccine is really important, and vaccine can cure the disease. Vaccine can prevent the disease. Okay, so regarding vaccines, you can say that for many years it is available, but it is not popularized, and there is no much of awareness. And still in our place, most of the people do not know that vaccine is available and vaccine can be helpful and it can be taken. Okay, but still it is there, and in USA it was long back it was used, and they are getting good results from that. Okay, so there are different types of vaccines. 3 types of vaccines are usually available. One is Cervarix, Gardasil, Gardasil 9. Okay, so nowadays the 2 types of vaccines are mostly useful. There is Cervarix and Gardasil 9. So actually these vaccines, they target the HPV viruses. And as you know that HPV viruses there are so many viruses. There are almost 80 strains are detected in about HPV, and out of that 40 are in 40 are mostly useful, or they are causing some diseases. Okay, and 80% of the patients, even normal individuals, are affected by HPV infection, but body's immunity will fight and it can win in most of the cases. But there will be some persons who will be affected by the disease, and in that case infection will continue. So in that case there will be chance of going to that carcinoma cervix. Okay, so that we can detect by different tests. As I told you, we do the pap smear. By that we can see the changes in the cells. And HPV testing is a direct testing by which we can know whether that person is infected or not. So that is also nowadays available. So we can combine these two, or we can do at different ways. Okay. So after that we can go for vaccines. So for vaccines, what will happen? So there is an order that that is a norms that how to give vaccines. So in vaccines, we have to give a patient when the patient is not exposed to sexual exposure, because that is the chance when there might be they may contact an HPV infection. So before that you have to give. That is why 9 years is the best year. It is recommended from 9 years onward. So 9 to 26 years it is said, but it is ideal to give below 13 years. That means before the onset or before the exposure to sexual contact. Okay, that is why we say it is the age recommended when you have to give the vaccines. Okay, then how to give the vaccines? So vaccines are simple. You can give an intramuscular dose only, and when to give. So you have to give one dose on the same on 0 day. Say that is the first day when you give. Then after that you have to give another dose after 6 months. Okay, so when you give 2 doses. But when we give 3 doses, sometimes we need 3 doses. In that case, one we give on 0 day, another one after 1 month, another one we give after 6 months. Okay. So usually what will happen if we give before 15 years of age, so that is the 2 doses are sufficient in that case. But if you give after 15 years of age, then 3 doses are required, right? And you need not give another booster dose. This dose is sufficient. This will cover lifelong, right? And in a patient who is already exposed to sexual contact, it is useless to give this type of vaccines. Usually we recommend in this way only, right? And another important good thing of the HPV vaccination is that, especially the HPV vaccine, which is multivalent, that is the Gardasil 9, which covers almost 9 strains of HPV viruses like 16 and 18, which are mostly responsible for cancers, such as cervix and other vaginal cancers. And besides that, there are another 7 strains which are responsible for warts. We call it vulval warts, vaginal warts, or like that, genital warts. So this type of warts are caused by this type of viruses. So that will also be prevented if we give Gardasil 9, right? So this is also now in the market, it can be given. And regarding the side effects are almost nil. This anaphylaxis reaction is also not known till now. And some patients there might be some sort of allergy, some pain, local pain, and these are all negligible. Nothing to worry about the side effects. And I think this should be recommended nowadays in the whole population, especially the youngsters. And it can be given if we give the multivalent one for male and female both. And for the female, it is must. So it should be recommended below 13 years of age, right?
Thank you so much, sir, for giving us this valuable knowledge on cervical cancer. You have given us what is cervical cancer, made us understand what is it, what are the risk factor, prevention, vaccine. So apart from that, sir, do you have any message for our public?
So before conclude, now I will say 2 important things for the viewers. So that is that cancer cervix is totally preventable and curable disease, provided we are aware and alert. Okay. For that, we go for screening the right moment, that is usually in 30 years of age or more than that, and whenever there is some alarming signs or symptoms, right? So in that case, it will be detected early at the treatable moment, and there will be prevention or there will be total correction or cure of disease. Thank you everyone for the patient hearing, and thank you Fetisha for this nice interview.
Thank you so much, sir. And with that, we conclude the USTM podcast. We hope this discussion has brought you a valuable insight and knowledge on cervical cancer. Remember, health is in your hand. Take right step at the right time. Until then, stay safe, stay informed, and we'll see you in the next episode. Take care. Thank you.